You're welcome to my YouTube channel, Next Connect Institute. Feel free to download the presentation, and if possible, you can also proceed to sharing it. Like and share this channel so that you are notified of more videos. In this session, I'm going to focus on a theory based on interpersonal relationships. This theory was developed by Peplau'S, Hildegard. It's important to take note that she was born in the year 1909, graduated in 1931 from a diploma nursing program. She did further education and obtained qualification in interpersonal psychology in 1943, psychiatric nursing in 1947. She also obtained a diploma in curriculum development in 1953. She participated widely in psychoanalysis for teachers, worked as the president for the American Nurses Association. Her works continued until she died in the year 1999. The development of this theory was based on other people's works and, of course, based on our existing nursing practice. Critical works that she obtained, some of the concepts includes works done by Maslow, Freud, Surveillance, and others. She also analyzed the interaction of student nurses with their patients. And apart from that, she also studied much of what happened during the stay of a particular patient in a ward. She also developed this theory based on a wide experience in the psychiatric field. Our own concepts, values, and beliefs about nursing also created a depth for this theory. The interpersonal relations theory contains basic elements, which include the patient, the nurse, the interaction that occurs between the patient and the nurse. Three critical elements. We start by defining, in this context, the client of a patient could be defined as a person or a couple, groups, or community that deserve humane care that should be offered to them with dignity, privacy, and ethics embedded in that care. The environment can be psychological, physiological, and social, and this is all about social fluidity that may be illness, maintaining, of course, promoting of health. Health can be defined as a forward movement of personality and other ongoing human process in the direction of creative, constructive, personal, and community living. In short, health in this theory is something that is not static, but something that is ever evolving. A nurse in this theory is defined as a medium of the art of nursing, or in short, a vehicle which is being used to offer this humane care. Nursing is defined as an interpersonal process involving the interaction between two or more persons with a common goal. And in this regard, this relationship or interaction should be therapeutic in process, or it should be healing. In short, she defined nursing as a healing art. What could be some of the assumptions for this theory? The first one is that the kind of a nurse each person becomes makes a difference in what each client will learn as he or she is nursed throughout his or her experiences with this particular illness. Secondly, it is assumed that fostering personality development in the direction of maturity is a function of nursing and nursing education. And therefore, this calls for self-nurse development in terms of skills and expertise. It requires the use of principles and methods to deal with everyday interpersonal problems or difficulties. The other assumptions indicate that illness provides an opportunity for learning and growth. And this is on both sides of the nurse and the patient. And also, it is also assumed that nursing can take as its unique focus the reactions of clients to the circumstance of their illness or health problems. So whatever the patient is going through, it can be used for the betterment of their health or well-being. She also assumed that all human behavior is purposeful and goal-setting in terms of feelings of satisfaction. The interaction of the nurse and client should be fruitful, and it should be a method of communication that should identify and use common meanings in a situation as it presents. She also assumed that difficulties in interpersonal relations occur in varying intensities throughout the life of everyone. And she also purported that the patient is able to participate in this relationship that is created between the nurse and the patient. Interpersonal relations will enhance self-maturity or self-fulfillment. This interaction is a phenomenon that occurs between two independent individuals. The outcome of the interaction can, of course, be positive or negative in nature. Positive in that it will create understanding, openness, it will allay any form of fear and anxiety. Negative in that it may create misunderstanding. It may also create closeness in terms of the patient not availing any information. It may also result in fear and anxiety. Factors that influence this interaction could, number one, be values, the beliefs, the culture, the race, the experience, expectation, preconceived ideas. And this is on either part, on the part of the nurse or on the part of the patient. Now, interpersonal relationships, through the interaction, a connection is usually established or created between two individuals. And this is ultimately what is referred to as rapport. Feelings and behavior toward each other is understood and accepted as individuals interact. Key to interpersonal relationships, number one, is effective communication. And this can either be verbal or non-verbal. Interpersonal skills, positive attitude exhibited by both, observation and perception, self-scrutiny. Now, the concept that Peplau'S created is that we have in the middle or in the intersection nursing, and on either sides we have the nurse and the patient. Each one of these individuals is trying to communicate in an effective way so that this interpersonal relation is created. The outcome of the nurse-patient relationship is that both will learn and grow from this experience. The nurse will obtain experience, and of course, the patient will learn to take care of themselves. Respect is created for each other. Both the nurse and the patient are empowered in so many ways. It improves the patient autonomy and maturity. Since they are empowered, they can make their own decisions. Anxiety is converted into purposeful actions. It also helps the patient to help themselves. It guides the patient towards healing. It results in improved healing outcomes, eye satisfaction for both. The patient will be happy, the nurse will be happy at the end of the day. Healing and caring is less stressful as it is done mutually. It increases the sense of responsibility for self in the patient. Now, this interpersonal process usually occurs in 4 phases. Number 1, there's a phase of orientation, during which there is establishment of the relationship. Identification is the second phase, in which problems that are presented by the patient are clarified. Exploitation, it is when selection of appropriate approach to heal or to get the problems or meeting the needs of the patient enhanced. Resolution, this relationship is now terminated. 4 phases: orientation, identification, exploitation, resolution. Now, on the orientation, there is acquaintancy process, preconceptions or myths are worked out, parameters are established, rapport is created, trust is developed, and the roles of the nurse are well understood by the patient. Identification, the client begins to identify the problem that they have. Then apart from that one, the nurse helps the patient to recognize their own independence by participating in roles and promoting self-responsibility. Exploitation, the client's trust of nurse has reached full potential, and the nurse therefore at this moment can usually bring in the nursing care plan and the nursing services. The problem is solved. If they came with dehydration, if they came with whatever problem, it is now being solved. Identification and orientation of the patients towards discharge is also exploited. Resolution, this is the final phase of this nurse-patient relationship. Sense of security is found as the patient has less reliance and identification upon nurse helper. The client has increased self-reliance to deal with their own problems. What could be the roles of the nurse according to this theory? Number 1, a nurse is a stranger. Secondly, a nurse is a resource person. A nurse is a teacher, a leader, a counselor, an advocate. Additional roles may include a nurse becoming a manager. Importance of this theory is that it helps one understand con behavior. It also helps others identify felt difficulty. The application of human relations to problems at all levels of experience is enhanced. Applicability in any nurse-patient relationship is well applied to meet patient needs. Apart from that, those who have gone through this theory have come to a conclusion that the concepts for this theory are very clear compared to other theories, consistent and well-defined and easily understood. It's simple in nature, logical, systematic, and of course provides a better view for nursing. Consistent with nursing values and mission, is holistic in nature. Descriptive middle-range theory can be used in any specialty across the nursing fraternity. It can be linked with practice and easy to apply, contributes to the nursing process or the nursing care plan development, easily accessible to practitioners to guide and improve practice. Contemporary use, of late it has been translated into multiple languages. It is used widely by psychiatric nurses, and it has stood the test of time, used widely around the world, integrated to nursing practice and policy development, and of course, it's a good reference to research. This is the end of this presentation. Remember to subscribe, download, share the video, and also ensure that you spread the news that Nurse Connect Institute on YouTube is happening. Thank you.